A very good evening, everyone. My name is Payal, and I welcome you all to We Talk to You, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute is a division of Indian Immunologicals Limited, IIL, which was established by the National Dairy Development Board, NDDB, in the year 1982 as its unit, and later registered as a company in the year 1999 with the name Indian Immunologicals Limited. Human Biologicals Institute was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HPI was established at Ooty. The facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in the year 2000. Subsequently, Human Biologicals Institute launched other vaccines, and currently we are the major player in human vaccines. With three state-of-the-art manufacturing facilities at Ooty, Gachibowli and Karkapatla, also known as Genome Valley, HPI has forayed into the market of clinically proven wellness products and infertility range of hormones. Our vision is to shape global healthcare by spearheading the One Health initiative, to innovate, produce, and market quality healthcare products and services to improve and extend lives is our mission, and we truly believe in providing affordable products through continuous technical innovations and improvements to meet our customers' need. We're proud to share about a green initiative. As a market leader, we have taken significant step to reduce the plastic burden by 160 tons per annum by introducing eco-friendly packs. As an organization, we take a corporate social responsibility quite seriously, either it's adoption of government schools, where IL is providing infrastructure and basic facilities, including help in midday meal program, and in association with NDDB through our gift meal program, over 2,500 school-going children are benefited on a daily basis. We are associated with FIAPO and working towards a rabies-free organization, a rabies-free country, starting with Thiruvananthapuram. So this was some information about Human Biologicals Institute. For more information, you can also log on to www.indiumin.com. So I once again welcome you all to We Talk Do You show. Today's show, we are going to talk about a very important yet common topic, common in the sense talking about the health issue where majorly women of India are facing these days. There's a particular health issue which is getting so common and is increasing at an alarming rate, considering the lifestyle factors or certain biological complications, biological factors. Today we are going to talk about PCOS, polycystic ovarian syndrome. Well, PCOS can cause a lot of complications. It can also include a complication known as infertility in women, and it can hinder the chances of conception. Well, there are so many questions that I'm sure people who will be watching this video with us today and who will be watching it in future will have. For this, we have a very special guest with us today, Dr. Neha Poddar from Ghaziabad. I welcome Dr. Neha in today's show and thank Dr. Neha for her time and for joining us today in We Talk Do You show. A very warm welcome and very good evening, Dr. Neha.
Hello, Payal. Thank you very much for inviting me. And many congratulations to Human Biologicals and to you for organizing this great show, great program.
Thank you so much, Dr. Neha. And once again, I still remember we were discussing, and we mentioned you mentioned that this particular topic is many people know, but still there are a lot who want to know more about this, and they should know about it because it's getting so common. So before we ponder you with a lot of questions about PCOS, first can you help us to know and our viewers to know why they should know about PCOS and what exactly it is?
Polycystic PCOS is polycystic ovarian syndrome. The name comes from the appearance on ultrasound, that is multiple cysts, multiple small cysts are seen on ultrasound. Hence the name polycystic ovarian syndrome. But basically it's a hormonal disorder just like thyroid. It's a hormonal disorder which occurs in women of reproductive age group. Before puberty and after menopause, it does not exist. It has no symptoms there. In women of reproductive age group, it is very common and cause multiple symptoms to women. It is as common as 20 to 33% women of all reproductive age group have PCOS.
Okay. So now, ma'am, so exactly this is getting so common, and I'm sure many of us here would agree that it is increasing at an alarming rate.
Yeah.
So can you tell us what exactly happens in PCOS, like as far the biology is concerned, in common terms, so that people can understand what exactly happens there?
First of all, I'll tell you about the symptoms, how a woman presents with PCOS, or when can we suspect that I should go for a testing for PCOS. All right. The most common symptom is delayed periods. A woman can come with irregular periods. Most common is delayed periods. She can have periods in once in 2 to 3 months or even more infrequent periods. There can be features of male hormone excess, just like acne, hirsutism. Hirsutism means growth of hair, growth of hair in male pattern, just
Okay,
like growth of hair over mustache area, over beard area, over belly area in male pattern, and also hair fall over scalp, especially in male pattern. Okay, women can present with obesity. Obesity is also a very common symptom of polycystic ovarian syndrome. Later on in life, a woman can present with features of subfertility. As you said, women can present with infertility or subfertility. These are the commonest features which a woman can come with, and in some cases, it can be asymptomatic also. It can be diagnosed by chance on ultrasound.
okay. So, thank you so much, Dr. Neha, for letting us know about it. So, according to you, what can cause PCOS? Is this something that somebody has it, or something that it is developed over a period of time due to certain factors? So that people can understand why it happens and how it happens, and later on we can move whether it is manageable or not.
Yeah. I always say genes load the gun and lifestyle pulls the trigger.
Great.
Basically, a woman who has genetic predisposition, whenever she has a faulty lifestyle, which most of us have, faulty diet or faulty lifestyle, she can develop PCOS.
So it is
Usually,
majorly
there
due
is,
to lifestyle factors.
yeah, it is basically there is certain level of genetic predisposition, but it is triggered by lifestyle. Whenever your lifestyle is disturbed, it can be in the form of sedentary lifestyle, it can be in the form of excess of junk food, it can be in the form of stress also.
Okay.
Yeah.
So, Dr. Neha, when somebody is suffering from PCOS, um, is there something like it? How does it affect the body? So, you did mention certain points that there are some kind of symptoms that a lady starts showing, like hirsutism and then delayed periods, mid periods, and then subsequently they might suffer from subfertility. So, exactly how it affects, like what it does.
The underlying factors that occur is usually hormonal imbalance. In what form? There is excess of male hormone in the body, and so the features of male hormone axis, as androgen levels increase, we call testosterone level in the body is increased.
Okay.
So periods are delayed, ovulation is seldom, and there are features of male hormone axis.
Okay.
Also, there is a very important thing which is known as insulin resistance. We all know insulin has some relation to diabetes.
Okay.
Insulin has a very big role in metabolism in our body, so it causes insulin resistance. When insulin is resistant, so it causes a lot of metabolic disturbances in our body, leading to all these hormonal imbalances, and later on a woman can have diabetes, increased risk of diabetes.
Okay.
There are a lot of things which can happen if PCOS is not controlled well in time. When you ask me that what exactly it causes in the body, basically it's hormonal imbalance and insulin resistance, but later on it can also lead to increased risk of diabetes mellitus, hypertension, increased risk of cardiovascular diseases, and in very very rare cases it has also increased risk of endometrial carcinoma also. Yeah.
Okay. All right. So we have read. I mean, there are a lot of articles available, Dr. Neha, that it mentions PCOS is something which can be reversed. It can be managed well. Like as you also said, if it is not managed early, so it can lead to many other major complications and consequences later in life. So, can you? I think it's the most important point. I'm sure many of us would be watching this video further would get a lot of benefit from this particular insights from you, especially. Like, how can someone manage PCOS if they come to know that they are suffering, and is there a possibility that it can be reversed?
We have discussed all the grim things about PCOS. Now the bright thing about is that it can be very well managed, and the most important thing about its management is diet and lifestyle, which comes
Okay.
foremost. The diet and lifestyle management comes foremost. If you want, I can give you certain points about it.
Yes, please.
Yeah.
Yeah.
Diet has the most crucial role in management of diabetes, in management of polycystic ovarian syndrome and any other metabolic disorder. What foods specifically a woman should avoid and what foods she should take, I'll focus on it. She should avoid foods with high glycemic index. What are the foods with high glycemic index? That is like sugar, carbohydrates, mainly cakes, pastries, these type of items. Dairy products also cause rise in testosterone levels indirectly, so they should also be avoided. All forms of bad fat, saturated fats, anything which comes in a packet should be avoided. Hydrogenated and trans fats, the oil which is cooked many times, margarine, processed foods. I mean, all types of food which comes in a packet should be avoided. And what should be included in diet? We all know green leafy vegetables. We all say include lots of fruits, especially bright colored foods and vegetables which have high levels of antioxidants in them, specifically apples, pears, grapes, also coconuts.
Okay.
We can include all types of healthy fats in our diet. Essential fatty acids like in nuts, avocado, olive oil. These type of fats we can include. Also groundnut oil. We should use more of whole grains instead of refined grains. Yeah,
Okay.
and whole fruits instead of fruit juices. Second important thing about management of PCOS is lifestyle. Diet I have mentioned. Lifestyle is second most important thing. One must include in some form of active physical activity at least 5 days a week and at least 45 minutes a day. Yeah, it can be in the form of brisk walk, yoga, cycling, dancing, zumba, swimming, any form of sports. It can be in the form of that. A woman who is obese, weight loss is very very important. Even 5% weight loss, not 5%, even 5 kg weight loss has significant role in reduction of symptoms of PCOS. She can regulate her periods by weight loss. She can regulate her symptoms of hirsutism, acne by weight loss.
Okay.
Yeah, and third thing is stress reduction. Stress, any form of stress like night shifts, it can also lead to hormonal imbalance. So, to reduce any form of stress, a woman can go for meditation, yoga, sports, cycling, any form of this type of activity. And then there come the roles of doctors like me. In certain patients, we can go for medications.
Great. Thank you so much, Dr. Neha, for answering this very important question. So, yes, as per Dr. Neha, PCOS is something which can be reversed and can be managed well with proper dietary balance and maintaining a proper lifestyle. So that was something. So Dr. Neha, anything else apart from this, like as an expert, who, you would like to tell our viewers about this particular health condition? Anything like something that they should take it from here.
All the young girls are involved in, and no, none of the young girls are involved in any form of sports activities. And uh, I must say, most of us are busy in our lifestyles. Most of us are busy with our Facebook, with our phones, and one thing missing in our life is active lifestyle. One must take out time from however busy schedule you have, whether you are studying, whether you are going to college, whether you are having very long shifts, but you should take out time for yourself. At least do yoga, at least do cycling, or if possible involve in some physical activity at least 5 days a week. That is foremost for any form of disease. If you want to keep yourself fit, you have to work.
Absolutely, Dr. Neha. I mean, thank you so much. I'm sure whosoever will be watching this video will get a lot of insights from this, and I'm sure they'll be benefited. Meanwhile, before we jump to our next segment of the show, getting some questions from our audience, I would like to thank, first of all, the viewers who have joined us live today in multiple channels, and I would also like to request them, if they feel that this particular discussion would help anybody they know, they can share it to their family, friends, and relatives. So they all can get benefited from this. And I would request, if you have any sort of questions that you would like to that you would like Dr. Neha to answer, you can put it in the comment section, or you can also put it in. You can send us inbox. You can send it us to our message box and Facebook page. So, Dr. Neha, we have already got a couple of questions in our inbox. With your permission, I would like to read some of
Yeah.
them. So, the first question is from Miss Soumya. Soumya is trying to ask, uh, are there any sort of tests which will help me to know whether I'm suffering from PCOS? Because
Bas-
I'm missing my period since 2 months.
okay, all right. Can you repeat the name of the person who is asking this
Soumya.
question?
She's
Soumya.
Soumya.
Hello, Soumya. Basically, if you have missed your period, you need to know about a few things. If it is regular that you are having delayed periods, or it is just this once that you have missed your period. If you are having delayed periods since a few cycles, then you should go for at least a thyroid test. You should go for a hemoglobin test. And if these two are normal, you should definitely go for an ultrasound. An ultrasound can tell you about whether you have PCOS or not. You
Correct.
should you should visit a gynecologist for a better opinion. If you want to ask something else directly, then I can reply.
Soumya, if you are with us, if you're listening to Dr. Neha, you can reply to the details that she has asked. I'm sure she can give a detailed answer to your question. So, meanwhile, we're waiting for Miss Soumya to reply, Dr. Neha. There is one more question. Doctor, if there are certain medications if I stop the medication, will I get PCOS back?
Basically, PCOS is a lifestyle disease. PCOS is a lifestyle disease. It is triggered only and only by defective lifestyle, not by stopping the medications. If you are if you are requiring medications for a long time, it means that you are not managing your lifestyle and diet well. And if you are trying well, then you need to be a little bit more aggressive towards it. All right. Because PCOS is basically a lifestyle disease. I have seen many patients who, when follow a strict, you don't have to do dieting. You have to just change your diet to a healthy diet, and you just have to make it very frequent to, as I told, at least 5 days a week, active physical activity. If you can achieve that, you can definitely keep PCOS away from you.
Thank you, Dr. Neha. Dr. Neha, Soumya has replied to the chat. So she is mentioning that she is 20 years old and have been suffering. I guess this is what she means. She's suffering from missed periods since a year. So that is, I think that is what she's trying
Yeah.
to.
Yeah. I'm not sure whether you have PCOS. It can be PCOS. You need to undergo a certain tests, and definitely, because you're 20-year old, you should go for certain tests, especially a hemoglobin, thyroid, a prolactin level, and also ultrasound. That will let you know what you have, and please consult a gynecologist so that she can tell you better why you are missing your periods.
Thank you, Dr. Neha, and thanks, Soumya, for your query. As Dr. Neha mentioned, you must visit your nearest gynecologist and do consult the doctor before coming to any kind of conclusion.
Yeah.
And it's better to go and visit a doctor rather than searching it by yourself because it's almost a year. So thank you so much, Soumya, for joining us today. And Dr. Neha, there is one more question that we would like to take. Um, so the name is not. So probably the question is, I'm suffering from PCOS since 8 years, and we are trying for a baby. Will it cause any problem?
Basically, PCOS will cause problem in fertility only if you have delayed periods. If you are having regular periods, it might not cause any problems. PCOS usually causes delayed periods, so you need to control PCOS. Just go in an active lifestyle, active diet, active lifestyle. Both you and your partner, you will conceive. Yeah.
Thank you so much, Dr. Neha. I would like to request if you have any more questions, you can please comment or inbox to us. You can ask Dr. Neha right here, or if you have any sort of questions you would want us to answer, you can also write to us in www.pubertytomenopause.com. In our Facebook and Instagram pages, we will surely get back to you with the answers. Yeah, I think these were certain questions. So we got one more questions, which is kind of repetitive, Dr. Neha, that you have already answered. So I would request the viewer to please do watch the video. Dr. Neha has already explained it really well. So actually, the question was about certain food that they should, you know, should take care if somebody is suffering from PCOS. I think with this, Dr. Neha, I mean, we definitely had a very insightful discussion with you. With such, it was really brief and all the important points insights that you have covered, Dr. Neha. I'm sure many would be watching this video will really get benefited. And I'm sure there have been so many articles about PCOS and what can be done, what should not be done. I mean, it is clouded all across. But coming from you, like an expert like you, would definitely help people who would be watching this. And I really thank you for that.
Thank you very much, Payal. It was really nice experience for me too. And thank you, Human Biologicals, for organizing this program so well. Thank you so much.
Thank you so much, Dr. Neha. And with this, I also thank all of viewers who had joined us today. And as I mentioned, you can definitely share this particular video with your friend, family, and relatives. I'm sure it will benefit them. And moving forward, if you have any sort of questions regarding managing PCOS or any other question that you would like P2M to answer, you can definitely log on to www.puberty2menopause.com. And if you want us to come out with a particular series of We Talk Do You on any other topic, you can please write to us. We will try our best to get the video or to invite the leading expert of our country to answer your questions. Thank you so much. And I wish you all a great evening and please take care of your health. Thank you so much, Dr. Neha.
Thank you. Thank you, Payal.